I think what surprises patients the most about our urgent care is the fact that they can come in right away, being seen the same day. Because when you're having pain or severe symptoms, every hour feels like an eternity. So be able to come in and get treated right away is very important.
So by getting in that same day, they're able to alleviate their concerns, and we'll be able to get them to any testing they need to on a timely manner.
My patients no longer necessarily have to wait 1 or 2 or 3 or 4 weeks for an open appointment. They can be seen that day.
We may be a bit quicker as far as recognizing symptoms or patterns of symptoms or patterns in lab work that raise a red flag to us that maybe would not be as quick to be noticed in a general urgent care.
What's unique about it, what's special about it, is that it affords a patient the ability to avoid an emergency room visit in many cases, come in and be seen the same day.
People realize very quickly that issues with their bowels and their abdomen are taken care of in a gastroenterology practice, that issues with swallowing or reflux, and even more so issues with pancreas, gallbladder, and liver, severe heartburn, abdominal pain, eating issues if you're having problems with being able to keep your food down or creating discomfort when you're eating. Those are all things that would be managed through our practice.
The urgent care is located in our clinic where we see patients all day. There's one dedicated nurse practitioner that sees patients that need urgent attention. And there are also several physicians ready to see the patient as well.
266-CURE is the phone number we have set up for our urgent care. And what that provides is the patient, they can call that number at any time of the day. And they can, if it's after, say 4 or 5 o'clock, they can leave a message and they will be contacted the very next morning for their appointment that day. If they call during working hours, they can come in that day through that number.
You do not need an appointment for our urgent care. You can make an appointment for our urgent care, but we also take walk-in appointments. I believe that we have excellent turnaround time for our patients, especially in an emergent situation. It is not uncommon for someone to present to our urgent care in the morning with a problem necessitating an endoscopy procedure and be down in our center having that exact same procedure done by noon or 1 o'clock. You will be brought back into one of our exam rooms. Basic health information will be obtained from you by one of our nurses, your medications, your past medical history, what have you. And in a relatively timely fashion, you'll be seen by one of our nurse practitioners that will be able to delve into whatever issues you're having at the present time. And based on that history, that will determine whether or not you need to emergently go for a procedure or x-rays or labs, or if this is something that can be ordered for you to do at your leisure with a subsequent follow-up appointment schedule. The biggest surprise patients have with urgent care is how rapidly they are cared for. We've had patients that literally come in the morning and are in surgery by the evening if the situation deems it necessary. So I think the expeditious nature of how we can manage these patients is what surprises them the most.